Good morning, good afternoon, everyone. It is a huge honor to welcome you today for the high-level dialogue on the power of health workforce to accelerate the reduction of maternal, newborn, and child mortality and foster thriving societies. Colleagues, this is a dialogue second in the series of conversations that bring together policymakers, healthcare leaders, donors, and experts to explore actionable solutions to improve health of women, newborn, children, and adolescents. And we have a sterling lineup of speakers and panelists who will be sharing their reflections with you momentarily. At the core of this vision is a critical truth that a strong, skilled, and supported health workforce is the foundation for achieving these outcomes. Today's discussion builds on the renewed global commitments enshrined in the 77th World Health Assembly resolution, which called for accelerated progress in reducing maternal, newborn, and child mortality. The urgency of these commitments cannot be overstated. Progress has stalled, or in some cases, even reversed. One pregnant woman or newborn dies every 7 seconds, according to the World Health Organization. 63 countries are off track to meet the newborn mortality target by 2030, and 54 countries are falling behind on the under 5 mortality target. The health workforce serving on the front lines faces immense challenges in the context where they operate, including ongoing conflict, climate crisis, emerging diseases, fragile health systems, and funding shortages needed to build strong, resilient health workforce and infrastructure. With a projected shortfall of 10 million health workers by 2030, primarily in low and lower middle income countries, the strain on health systems continue to deepen. In addition to the shortage of health workers, how can we expect them to deliver in the context where there is no electricity, inadequate wash facilities, and a lack of essential medicine? Their workloads continue to increase without adequate compensation, and often they face threat of violence. Central to the WHO 77 resolution is a call for holistic investments in the health workforce. The resolution recognizes this by reaffirming the urgency of equipping health workers with the capacity to deliver integrated, people-centered care. One of the powerful examples of this integration is midwifery-led continuity of care, also emphasized in the resolution. Midwives, when equipped with the right resources and supportive work environments, play a pivotal role in reducing maternal, neonatal, and child mortality. Equally, adequate attention must be given to recognizing critical roles of neonatal nurses and community health workers in achieving these outcomes. Critically vital to achieving our goals is fostering interprofessional collaboration. Unfortunately, in too many health systems, this is not the case. No single cadre of health workers can address the complex needs of maternal, newborn, and child health issues alone. High-quality care depends on cohesive teams of midwives, nurses, physicians, community health workers working together harmoniously. Such collaboration ensures continuum of care that is comprehensive and responsive to the needs of women, children, and adolescents. The conversation we will have today serves as a call to action to value, support, and mobilize the health workforce. It is equally important to protect and empower them through gender and equity lens. Health workers are a lifeline for mothers facing complications during childbirth, for newborns taking their first breath, and for children whose health will shape the future generation. I really encourage you to engage actively in today's discussion. As I said, we have a sterling lineup of speakers, and it is my great pleasure to invite, first of all, our keynote speakers to share their reflections. And I have the huge honor to welcoming Her Excellency, Dr. Mekdes Daba, Minister of Health for Ethiopia, to share her keynote reflection. Dr. Daba, over to you.
Thank you very much. Thank you, Excellencies. Good morning, good afternoon, good evening for those of you who are also joining us in a different time zone. It is a pleasure to join you today to discuss about a very dear topic to my heart and also to most of us who have also joined in here. It is a privilege to stand before you today to speak on accelerating the actions to reduce maternal, newborn, and child health mortality, an agenda that demands a collective effort and a commitment of everyone, everywhere in the world. Ethiopia, being one of the countries with over 120 million population, is deeply committed in improving the health and well-being of our community, with a special focus that we give to women, children, and adolescents, and neonates and newborn. Our Ethiopian Health Transformation and Investment Plan, which is a 3-year plan now, being guided and aligned with the national strategy. The first key priority we set is the work that we want to do in RMNCH. It is guided by our periodic health sector transformation plan, and we have made significant global and regional commitment, including the Sustainable Development Goal, which is just a few years ahead. I mean, we're now left with almost 5 years to close this targets. And also the UHC target, where we want to have universal healthcare coverage for all, aiming at achieving health equality for all. Our population of 120 million are set in different corners of the country, where one corner of the country could have a different type of geographic, ethnic, religious, and other fabrics compared to the other corner. But UHC and achieving equity is at the cornerstone of what we want to do when it comes to our MNC targets. Maternal mortality in Africa, in our region, has declined significantly over the past decades. If you remember, back in 2000, we have one of the highest maternal mortality in the region, with around 857 maternal deaths per 100,000 live births. And this has almost reduced in the entire regional average of 525. But look at this number. As we speak, we are already losing mothers and also newborns at all corners of the globe, all corners of the region, and the highest maternal and newborn mortalities are highest in our continent, which is a sad fact. But Ethiopia has made remarkable progress over the past years, with the maternal mortality dropping from currently where we have, what the data we have shows around 267 per 100,000 live births. And the neonatal mortality also reached around 26 per 1,000 live births. But this number is still striking. We need to reduce with the target that we set for the SDGs. We are way behind. And the last two numbers that I've mentioned are an estimate that we have from UNICEF, WHO, and UNFPA estimates. And we are also parallelly right now doing our Ethiopian Demographic Health Survey. Our contraceptive prevalence, which is also one of the contributors for the targets that we set in our MNCH, has also reached around 41% by the data we have in our Ethiopian Demographic Health Survey, mini DHS that we have in 2019. And it's a key achievement that we have, despite the unprecedented challenge that we got from the climate change, conflict, and mainly the cross-cutting challenge we all faced, which is the climate change and COVID. This progress is the result of targeted initiatives that our ministry, our government has taken. Among them is our health extension workers, the health extension program, which is led primarily by young women, by the way, young women in different corners of the country. And it has been really pivotal in providing access to reproductive, maternal, and newborn plus child health services, the entire RMNCH, at a community level. Because our target is more to go from a community-led strategies and policies that goes to every side, from the community to a decision-making level. However, one critical factor that I always underpin, and we always underpin, is the effort of our health workforce. The importance of investing in a well-prepared, fit-to-purpose health workforce cannot be overstressed, which I'm sure all of you in here agree with me. And our health professionals, from doctors, nurses, midwives, community health workers, which we say in our setup, our community health extension workers, are our frontline workers at all times. We all remember who was at the forefront when COVID hit our globe. They are our backbone for our healthcare system, and their skill, commitment, and resilience and driving progress and reducing maternal and newborn deaths. All the data that we speak is from the investment and the commitment that we see from our health workforce. Ethiopia has invested and trained a larger number of midwives over the years to ensure that we have access to skilled birth attendants who are really providing basic emergency obstetric care. And we have also introduced an integrated emergency surgical officers, the ISO program, which some of our regional colleagues and our regional partners came to learn and also start to implement in different parts of the continent. We have this at a master's degree level, ensuring that emergency obstetric care are implemented, especially by trained health officers. This has been also coupled with specialty nursing programs focused on neonatal care. We have also specialist nurses in neonatal care. These measures have significantly increased our access to life-saving maternal newborn health services across the country and across the different parts of the regions in our country. And training advanced professionals and also at the doctors, from the general practitioners to OBGYNs, including working with our other countries in the region, is something that we are very proud of, but we want to continue to work in our South-to-South collaboration so that we can increase our access to our MNC services. We are also training at subspecialty level in different cadres so that we can ensure that our MNC services are covered from the primary healthcare to advanced treatment as needed. Despite these achievements, of course, the journey so far is not over, and there is a lot that we need to invest and to still tackle in reducing the maternal and newborn and child mortality. And this requires an effort of training more, deploying more health professionals that are equipped and address the unique needs of our community. It is not just about numbers, by the way. It is about the quality and the competence that our health professionals would need, ensuring that the health workers are well-trained, motivated, and supported. This is what the Ministry of Health and our government is now doing with professional societies, civil society organizations, and partners, helping them that they could benefit from all scientific advances, including newer initiatives that the globe is now seeing, digital tools that can be on their hands, helping them in decision-making. And we're also trying to explore different ways now that we can also integrate different advances, including AI. Today's dialogue will present us a critical opportunity to discuss on how we can accelerate the implementation of the WHO 77 resolution our country and the other countries in the globe have committed to, with a particular focus of the health workforce role in achieving UHC and improving the perinatal, maternal, newborn, and child health outcomes. Let us really join our hearts together in investing in empowering our health workforce and women, which are the cornerstones for our policy. Together, we can really build a stronger and more resilient health system, which is capable of not just achieving SDG 3, but beyond, to secure that we have a healthcare outcome for the future that we want to see for ourselves and the generation to come. Really, I want to extend my heartfelt gratitude to the Partnership for Maternal, Newborn, and Child Health, the PMNCH, for organizing this valuable dialogue that we are here. And I look forward to the fruitful discussion ahead and addressing the health workforce challenge, but not just talking about the challenge, but we would be sitting together to challenge the challenge together and change them into opportunity. I thank you all.
Thank you. Thank you so much, Dr. Daba, for those reflections and sharing with us the Ethiopian model that has come to form as an inspiration and as a blueprint for other countries as well, and the enormity of the initiative that you're taking in terms of training young healthcare workers and building a cadre for frontline healthcare workers to deliver. We have now next a person who's a great champion and a friend of the Partnership for Maternal, Newborn, and Child Health, Director for the Health Workforce Department, Dr. Jim Campbell, to share his reflections on the issue. Jim, over to you.
Thank you very much, Rajat, and to all the team at the partnership, Dr. Mekdes, Daba, the other distinguished panelists, representatives from professional associations. Wonderful to be here to really push forward on this agenda. Just a few key points from my side, if I may. We have clearly a diplomatic consensus in the World Health Assembly through WHA's 77 from June this year, which highlights, yes, that the global level, at the aggregate, that we are behind the progress that we would have anticipated if we wish to reach the ambition of the 2030 goals. We know that at aggregate level, that's not all bad news. Many countries are making excellent progress on some of their indicators, but there is stagnation. And we've got this diplomatic consensus that says we have to address the environment, we have to address the supply chains, we have to address the investment, and we have to address the workforce. And particularly around the education, the employment, and I'll come back to that, the regulation and retention of the workforce, and respond to accelerate other actions on existing diplomatic consensus that we have on prior resolutions on the health and care workforce. And those resolutions, 7 of them, will be coming back to the executive board in February 2025, in the assembly in May 2025 for progress updates. And so the Director General will be presenting his report around what are the issues around the health and care workforce worldwide. And let me just share some of the key findings. As Rajat correctly said, this is not about one single occupation. This is about the multidisciplinary team that can provide services from community to facility to referral to specialized care as and when serving the populations they need, as and when women, newborns, children need to access those services. But we're not making as much progress as we hoped. When we presented, Rajat mentioned this 10 million workforce shortage projected to 2030. That is data from pre-COVID-19. What has happened since COVID-19 is that progress has stagnated. It is again at the global aggregate level. Some countries are making excellent progress, but at the global aggregate level, it's stagnation. And the projection for 2030 is a greater shortage, perhaps just over 11 million in terms of the needs that we'll have, but it's not equitable around the world. And this is the real point, which is so critical for this constituency and this discussion. That shortage, where those countries that are furthest behind on the progress on maternal mortality, newborn mortality, childhood illnesses, are also the same countries where the progress on the education, employment, retention of the workforce is not making as much progress. What we're seeing is that there's going to be a greater shortage in Africa, in the Eastern Mediterranean region, the same countries that are already falling behind. And why is this? What we're seeing is the education production, there's different models. Education production is really making progress. Ethiopia, Kenya, South Africa, different countries in the world really driving the production capacity of the health team, the professional health team. But we're seeing, and we're already, somebody put a question in the chat here. What we're seeing though is we're not employing those graduates and we're not retaining the workforce. The enabling environment, when the resolution that we adopted in June this year talks about decent work, the making sure, and the vast majority of our workforce in these countries are women, making sure that we've got gender appreciation, making sure that we're paying people properly, giving them an enabling environment, water, electricity, sanitation, supply chains, making sure the shift patterns, that there are enough people to cover those shifts. And if we don't fix the system issues, we're going to see people determining with their voting with their feet, looking at opportunities to move out of the public sector into the private sector, into jobs and occupations that offer decent work, moving out of the jurisdiction, not only moving from rural to urban or public to private, moving to faith-based organizations, NGOs, still keep people in the country. But more and more people finding themselves in precarious work, unemployment, and choosing to leave the country, taking their competencies, their skills, their license into an international labor market. Migration is at record levels. around the world, economic demand from higher income countries, providing opportunities and terms and conditions of work, better pay than many of the jurisdictions. So we've got some fundamental system problems that need to be addressed. How do we create the enabling environment? How do we ensure the investment in education is matched by investment in jobs? How do we ensure the graduates coming to jobs which are decent work, ensuring equal pay for equal work at equal value accordingly? And my final point, Rajat, to the colleagues that are really looking at this review in the criminal professions and many other experiences, we've got to come back to the point of decent work and gender again. And we see that around the world, roughly 2/3 of the workforce are women. That's slightly different in the African region and slightly different in the EMRA region, where maternal mortality levels are particularly challenging. And we need to be nuanced. We need to be specific to each country when it comes to gender. But the reality is that weak health systems that are underfunded, under-resourced, and undervalued are transferring the burden of health and care onto the shoulders of women around the world. Women as beneficiaries of health services, women as agents and workers in the health system, they are the ones that are transferring this burden, and we've got to come back to this decent work agenda, protecting, safeguarding workers, for them to be part of a resilient health system. We look forward to working with all of you to accelerate action on maternal mortality and newborn child mortality, but as well accelerate action on the investments in education and jobs in the health and care workforce and protecting the workers. Thank you.
Thanks a lot, Jim. Really appreciate the emphasis that you brought in terms of the fundamental system problems that we need to address to achieve the shifts and accelerate action that is needed. But also, thank you really for your own stewardship, for creating the opportunities that we have in terms of addressing these issues. We do have the leadership of several healthcare professional organizations up next as part of the panel discussion. But before I go to them for their reflections, I have the huge honor of welcoming Dr. Yaya Lavela, who's representing here Minister of Health for Government of Liberia, to share her brief reflections on the topic, and then we come into the panel discussion. Yasa, over to you.
Thank you very much. Your Excellencies, distinguished guests and representatives of countries present, organizers of this very important dialogue. I present heartfelt compliments from the Minister of Health, Dr. Louise M. Porter. The Minister extends her sincere appreciation to Partners for Maternal, Newborn, and Child Health for organizing this event, and also wants me to inform you all of how much she would have loved to attend, but due to ongoing engagements, she's unable. It is both an honor and a great responsibility to represent the Honorable Minister to discuss a topic that touches the very core of what it means to build a healthy and thriving society. Maternal, neonatal, and child mortality remains a pressing global health challenge, especially for Liberia. While we've made significant progress in improving key outcomes for maternal and neonatal health, our maternal mortality rates remain unacceptably high. And this is something the Honorable Minister, who is an OBGYN and a passionate advocate for women's health, has vowed to do something about. So in 2014, when Liberia was hit by the Ebola virus pandemic, two main lessons we learned. The first thing, our healthcare system crumbled because we already had this fragile system that was impacted from the civil war and recovering. So one of the lessons we learned was our community lost trust in the healthcare system, and we had going to traditional birth attendants to give birth. So we leverage the resilience of our community to build a very strong community health worker program that has been doing so well and is currently thriving. Another lesson we learned was to increase the capacity of our skilled health workers by ensuring that they attend trainings and different capacity building area that will impact our healthcare sector. After the Honorable Minister took over the Ministry of Health, the ministry has been reviewing the equitable distribution of health workers across the country. During our assessment and county tour, we realized that the Western region, with a population of 408,567 population, suffers a severe shortage of skilled health workers, specifically midwives. Currently, 2 great initiatives are underway. One, the ministry has embarked on a project to launch a midwifery program in one of those counties in the Western region. And that program would be to empower skilled midwives that will serve 3 great counties in the Western regions, which is Bomi, Kepma, and Babolu. These counties are counties that suffer maternal mortality extremely, especially the Babolu County. Currently, we are in the final preparation phase of establishing this program, which will offer an associate degree to these counties. Another thing that was discovered was the lack of nurse anesthetists and scrub nurses at major health facilities across the country. The ministry has been working closely with the John F. Kennedy Medical Hospital, which is the national tertiary referral and teaching hospital, to design a program that will enhance the availability of skilled health workers by implementing a comprehensive training program for nurse anesthetists and perioperative nurses. 3 objectives we hope to achieve. 1, improve anesthesia care during surgical delivery and obstetric emergencies, improve surgical nursing care before, during, after surgical procedures, improve diagnostic accuracy and efficiency in maternal health care. And I'm proud to say to you today that that program will be launching this week, and we'll be already like bringing on nurses for training. So in terms of enhancing our health workforce, we know far beyond empowerment of health workforce, training and equipment of health facilities, we have to create a clear and strong system where health workers can thrive. We must provide them with infrastructure, resources, and support to deliver on their training. We must prioritize their mental health, support, fair wages, and safe working conditions. Yesterday, the President, His Excellency Joseph Yuman Boakai, announced a salary increment for all health workers across the country, reaffirming his commitment to improve our healthcare sector. The ministry and partners are currently conducting several in-service trainings for health workers across the country and working on a policy that will integrate traditional birth attendants and redefine their roles to support maternal and child health care across the different communities. The ministry has also submitted a request to WHO for technical support in the maternal and reproductive health area. For the last 3 months, preliminary reports coming in have pointed to a slight decrease in our maternal mortality rates across the country. Our current rates, what we all know, stands at 742 per 100,000 lives, which is unacceptably high, because we know that we had a target to bring it down to 492 in 2021, and we know that we are far behind achieving the SDGs. In a conclusion, the challenge before us is significant, but so is the opportunity. By empowering our health workforce and equipping them to be agents of change, we are not only addressing mortality rates, but laying the foundation for societies that thrive. The power is in our hands, and with collective commitment, we can achieve a future where every mother, every child, and every community is given the chance to flourish. Thank you very much.
Thank you. Thank you very much. I somehow misplaced my mute button. Thank you. Thank you, Dr. Yasser, for those remarks and sharing your reflections. Colleague, when we have these passionate group of speakers, time management is not always very easy. So as I branch into my esteemed panelists to share their reflections, And mind you, this is a complete rock star, the lineup of speakers that is coming up for the panel discussion. I do urge our audience to get their questions ready and use the chat function to engage in these discussions, and for our panelists to look at those questions as they frame their remarks. As I said, colleagues, this is one of the most formidable panel of experts and leaders that we have coming up to share their views with us. They will reflect on the current situation, the barriers that we face, what can we do about it, and as Jim Campbell very nicely put in his remarks, how can we achieve the shifts we want to achieve? So with that in mind, I would like to call upon first you, Anne Chiara, the President of International Federation for Obstetrician and Gynecologists, to share your reflections. Over to you.
Thank you, Rajat. Excellencies, dignitaries, panelists, partners, and colleagues. I want to start with a clarion call. Our health outcomes are a reflection of our investment in the health workforce, particularly in maternal, newborn, child, and adolescent health. The health workforce must be proficient, productive, and must perform their duties, thereby reducing morbidity and mortality towards having a thriving human capital contributing to development. We are critical in provision of primary health care and universal health coverage, as was well articulated by Her Excellency. But we're in a context that is changing and evolving. The global stressors are with us: wars and conflicts, climate change, mental ill health. The list goes on, emerging diseases. So even for us as the healthcare providers, we are noting the change in epidemiology of diseases and are faced with numerous challenges. Should our policy environment change? Should our regulation change? Should our curriculum and training be made fit for purpose with integration of the current public health issues? The scope of practice, task shifting, task sharing. Skilled yet unemployed. This is a call from very many people where governments have invested but are not assimilating health workforce. Staff shortages, caseload to staffing, skill mix wanting, performance, absenteeism, demotivation, burnout, attrition, migration of our workforce, industrial strikes, career progression setbacks, and a poor work culture, health inequities, what we call the deserts of even service provision in some places, gender disparities. We all know the biggest workforce is women, but in leadership, where is their voice? Where is their agency? Weak health systems was alluded to us by James. And yet you expect us to provide respectful care and to optimize patient experience. We need this to be looked at. The other elephant is the lack of research on the health workforce itself. Number two, in our medical education and the outputs and outcomes and impact of what we are trained to do. And yet we are the critical force. So I speak to something I really like, which is the health workforce ecosystem for accelerated progress and our leadership as the health diplomat. It's not enough to just see a provider as providing services or obtaining their training. We must have health workers moving into the space of policies and planning for quality of care, re-evaluate the health system and the enabling environment we need even for ourselves. Equity, data for action, the return on investment, particularly with the programs that health workers provide, the pediatrician, the neonatologist, the gynecologist, the midwife. Do we really look at it from their lens? Response and resilience. Our role in even addressing life-saving commodities and being partakers at the table as these discussions go on, participating in advocacy, and last but not least, in research innovation, and knowledge exchange. The list can go on, but I'll leave it at that and give you what I perceive as opportunities. First and foremost, I want to really accolade the politicians we do have here and the Ministry of Health that is represented here, because it is your commitment that starts the journey to get the best out of your health workforce. But we must rethink, with the changing global context, our normative environment. The policies for too long have been siloed. And one of the reasons I'm really appreciative to be part of HCPA, rethinking how we can collaborate as multidisciplinary, if not even multi-sector. The globalization of competencies. We have looked in country, in region, in nations, but maybe we need to have a rethink to have a global curriculum fit for all health workers into labor markets. Our leadership is critical, and particularly more so for those who are at the front line. So those working in communities, our midwifery-led programs, the emergency obstetric and neonatal care, and its continuum. You start today as a mother, you are a neonate, you're a child, you're an adolescent. It's a cyclic manner of monitoring and evaluating the health workforce fit to work in those programmatic areas. And research. Health equity must be provided with a robust health system. But we must also emphasize, and I really can't underscore this, the valuing and the attitude transformation towards the health workforce and amongst ourselves as the various cadres trying to optimize patient outcomes. Creation of communities of practices, networks, and even centers of excellence, so that you may actually have enabling environments for the health worker to exude their fullest potential. Both supply and demand is met. Research must be undertaken, with the health workforce informing our medical education, the working environment, best practices, and feedback into policy, advocacy, and even provide innovations to be catalytic. Collaborative partnerships, interprofessional, academia, researchers, professional bodies, non-governmental organizations, CSOs, public-private partnerships. This must be accentuated to make progress. And then the engagement of multiple sectors. Advocacy and accountability. We must invest in this. And finally, I want to call us all to action. We must all engage to creating a health workforce that is per excellence to accelerate maternal, newborn, child, and adolescent health, to reduce morbidity and mortality, particularly in our regions and LMICs, and have, therefore, thriving societies. Thank you.
Thank you. Thank you so much, Anne Chiara. And always an inspiration hearing you speak. And what a amazing note to end your reflections with, creating health workforce excellence for acceleration. Next up is a dear friend and a champion in his own right, the president of International Pediatric Association, Naveen Thakur. Naveen, over to you for your reflections, please.
Thank you, Rajat. I don't want to repeat what has already been said. And Anne has covered practically all the challenges faced by health workforce and other speakers also. And it is not different for the pediatrician or health workforce, which is looking after the children. So yes, workforce in every country is under stress, and partly due to pandemic and many other reasons which Anne and other speakers have enumerated. There is a definite underinvestment in workforce worldwide. Huge need of investment, but not keeping with the demand. And every donor, every agency has their own focus in particular countries. And as I always said, we want to work where nobody is working with the government. And I take this opportunity to assure my Honorable Minister of Health that healthcare professional constituency is working very closely, and we are ready wherever you want us to work. I remember a study few years back when they said, where are the pediatricians? And we realized there are even some countries where it's not in more than 2 digits. So it's a huge disparity, and we have have to work together. Now, coming to what we can do in general and what we can do, what is the topic, polycrisis, conflict, climate, and pushback on rights. So there is a need for a health system designed to prioritize vulnerable children with tailored intervention for their unique need. Because if they have unique needs, and we have to design how we prioritize. I fully agree. We need collaboration with OBG, with midwives, with neonatal nurses, everyone. And we have created a very good example working in Nigeria and Indonesia, where we have brought all the partners together, and that it is helping us for the HPV and other programs. Now coming to the poly crisis, we said conflict. So in addition to what we train our healthcare workers, they need something more. They are not trained to work in crisis. I remember there are disaster management courses, and we used to do in IPA. They have to understand how to respond to the trauma, ways to deliver solution in disrupted societies, extra advocacy for the future implication. And we are working with other partners to create a team which can move fast with ISO, with ISPCAN, and many other, where it is a multidisciplinary team. We can move together. So the healthcare workers are trained and be prepared to respond to that crisis, because when crisis occurs, there is no time. Coming to climate change. Climate change, we thought we may not see implication in our lifetime, but we have seen everything, even in India. The heat waves, the flash floods, and everything is affecting, and we can see that. But our workforce is not trained. Even we don't take environment history for how it is affecting. So we need to train them, and we need to prepare them. Coming finally to the rights, and here we are talking about sexual and reproductive rights. And a big problem is a growing anti-science and like what we saw in anti-vax and vaccine hesitancy, an effect of infodemic. And our workforce again is not trained, well equipped to deal with these issues. They need to be trained in interpersonal communication, media, social media training, advocacy. And if I give example of our project in Nigeria and Indonesia, where we have created practically every district of Nigeria and Indonesia, every region, our resource pool who can respond, and we can do same in the other countries. Another example is our IPA vaccine trust course, where we train in all these issues which are never taught. So we have to see that we all work together. We have to see our health workforce gets training and support to deal with these issues. Like newborn, we are creating a whole pool of resource person from Africa in our next Congress. But what next? If we don't get support from donor, we don't get support from the government, it will not move. So I take this opportunity to call for action to the government, to the donors. We are willing on behalf of all healthcare professional constituency to move in wherever you want us. Thank you so much, Rajat.
Thank you. Thank you so much, Naveen. And then also, bringing in the context of polycrisis, but not just polycrisis as a challenge, but polycrisis as the opportunity. It presents us in terms of bringing the different capacities of healthcare workers together. Colleagues, we have about half an hour remaining for our dialogue and 4 more speakers, and hopefully some time for question and answers as well. There are various questions that have popped up in the Q&A function, some targeted to specific features. I really urge you to please have a look at them so that we can, address the ones that can be addressed as such. In the meantime, I would like to turn next to you, Sandra. Very much welcome, and really great to have you, and in your capacity as the president of the International Confederation of Midwives. Over to you, Sandra.
Thanks so much, dear Rajat, distinguished guest, dear partners, dear colleagues and healthcare students that are attending today to this webinar. First of all, I'm so thankful and honored to participate with you today and this webinar that's organized by PMNCH and HCPA. And of course, as we were hearing all the speakers before, we have so many things to reflect about as healthcare professionals. And of course, giving you this statement, we also are really dedicated to well-being of communities worldwide. We recognize that our work is shaped by an increasing complex array of challenges, as everyone has said today. This polycrisis, of course, this intensifying conflicts we are having all around the world right now, the climate disasters, the rollback of fundamental rights demands resilient, responsive, and right-based healthcare workforce, particularly for the health needs of women, children, and adolescents. As we have heard also, these challenges threaten not all individual health, but the very foundation of human rights and equitable access to care. And of course, in this arena, midwifery faces systemic gender biases that limit training opportunities and career advancements, especially regarding gender equity in midwifery, that really must be addressed to empower women in the profession and improve maternal and neonatal outcomes, as we were hearing, of course, before, the healthcare careers and mainly, for my women, almost 70, 80%, in some countries, 90% of healthcare workforce are women. So all of us, especially, midwives and nurses and of course, OBGYNs are women, are facing these gender biases that we really have to see and look for. And many countries, particularly in my region, Latin America, of course, have lacking enough midwives. And we need to really look at this building capacity in the regions, in different regions all among the world, of course, is critical. And of course, in this arena, the International Confederation of Midwives stands alongside healthcare workforce in advocating for a line trained health workforce, of course, that's able to meet the needs that we really need to be able to take care of course, in a compassionate way. We, midwives are, of course, primary providers of maternal and reproductive health care because we are really all around the communities and we are really close to the women and their families. And in this case, we play an essential role in supporting and empowering women and children and adolescents, of course. And because of this, ICM emphasizes the importance of investing in midwifery education, as we agree, supporting policies and community-based healthcare infrastructure is really important because there's where we have to be close to the families, close to the communities, close to the women that need our care, of course. And such investments ensure that midwives and other healthcare professionals are well equipped to navigate the pressures brought by crisis, uphold the rights of those they serve, and maintain the highest standards of care, of course. And we have to think and reflect that we are in a time that unprecedented challenges. Every day is something different after the pandemics. We don't know, we are not sure what will come. So in this case, we really call on governments and international organizations and civil society to support policies to fortify, of course, the health workforce, protect essential services, and uphold the rights of vulnerable populations that also are at some point, fighting for being heard. And of course, in our case as midwives, we really need to expand training programs of midwives to ensure competency and evidence-based practice. We have to advocate for midwifery-led care as cost-effective and high-impact approach. This year was the midwifery models of care was launched by WHO, and it's really important that it's a lot of evidence-based that says that it's a way that we can move forward to be closer to the communities, and we really can have a good results. And of course, also at this point, we have to strengthen collaboration between midwives and other healthcare professionals. It's so important. I agree, as Dr. Naveen has said. Of course, that's important that we have many evidences where we can be working together at country level, midwives, OBGYNs, pediatricians, nurses, all of us together, because we all have a goal that is being there for the community and women and their children, of course. And we can, of course, foster this team spirit. And as I agree, as everyone else has said, of course, that together we can work towards a more inclusive, equitable health system that adapts to the evolving needs of our world. and safeguards the health and dignity of people that is so important, because in one hand, we can access healthcare, but also with dignity. And it's really, really important, especially women, children, and adolescents that are really facing and struggling in this moment, of course, and the adversity that is all around the world.
Thank you. Thank you so much, Sandra. Extremely helpful to have your reflection from midwifery perspective. And again, something which is emerging as a clear theme across different presentation and emphasis, the need for collaboration and partnership across disciplines, across different cadre of healthcare workforce to deliver on the kind of shifts we want to achieve to address the magnitude of challenges facing women, children, and adolescents. Last but not the least, we do have Dr. Patrick Tu, who is on the board of the International Federation of Neonatal Nurses, to share your reflections. Over to you, Patrick.
Thank you so much, Rajat. Excellencies, dignitaries, partners, and colleagues. Allow me to talk about strengthening neonatal nursing, especially in our low and middle income countries, specifically addressing the challenges and opportunities for neonatal nurses. So today, I address this critical issue, yet it is often an overlooked issue, the undervaluation and under-recognition of neonatal nursing, especially in our low and middle income countries. So neonatal nurses are the lifeline for our most vulnerable population. These are the newborns, yet most of them, many of these workers that work within the newborn units are volunteers or work outside their scope due to lack of formalized roles and recognition within the healthcare system. So we need to address this gap to improve neonatal outcomes and achieve the global health goals. Allow me to highlight the challenges that neonatal nurses face across the low and middle income countries. So the first one is under recognition. So neonatal nursing is not formally acknowledged as a specialty in most of the countries within Africa. This one limits the potential and also undermines the key attributes that we are working towards reducing the neonatal mortality. So we need to call our various training institutions to actually synthesize and allow the neonatal nursing as a specialty and recognize neonatal nurses. The second challenge is shortage of training programs, especially geared towards training of neonatal nurses. So specialized training programs are very few, making it difficult for nurses to gain the skills needed to attain high quality neonatal care. We also have another challenge, that is the poor workplace and environments. So many of our low resource settings lack supportive workplace environments, leading to low retention rates for nurses. And this one has led to more of our nurses migrating, seeking for greener pastures, especially in the outside well-developed countries. And this one has greatly impacted on the outcomes. Despite those challenges, we have some few promising initiatives that we are currently undertaking within Africa. So we like to applaud the work that the Council of International Neonatal Nurses is doing, and in partnership with other organizations. So the COIN recently partnered with Nest 360, which is a global partner and an organization. And they have an aim of developing scalable innovations for neonatal care, and this will greatly impact on the outcomes for our neonates. So these initiatives will equip nurses with tools, skills, and support, showcasing how global collaboration can transform neonatal care. I'd also like to highlight the work that is being done by the community of neonatal nursing practice under the leadership of Council of International Neonatal Nurses in terms of developing the modules for training healthcare workers who work in newborn units. This community of neonatal nursing practice has actually developed modules that nurses can access across the globe and have first-hand information on evidence-based practice. So having said so, we need to address these gaps. So to address these gaps, these are the few solutions that we can do. So we need to pitch and encourage formalization of neonatal nursing roles, especially within Africa. So we are advocating for recognition of neonatal nursing as a specialty with a clear scope of practice and appropriate compensation across Africa. We are also advocating for expanding training and mentorship. So there is need for development and scaling specialized training programs, creating a structured mentorship opportunities, and establishing knowledge sharing networks. I also talked about work environments. So we need to improve the work environments, especially for the nursing workforce, which offers mental health support, promotes work-life balance, and fostering job satisfaction to retain and empower neonatal nurses. We also need to engage the next generation. So young healthcare professionals face significant challenges in sexual reproductive, maternal, and newborn care workforce. So to attract and retain the next generation of neonatal nurses, we must address their challenges and provide tailored training opportunities. We also need to offer structured mentorship guide to guide their growth as well. To create a positive and supportive work environment that fosters career satisfaction and personal well-being. And this one will actually contribute to retentions of our next generation and growth in terms of care and neonatal outcomes. So as I conclude, as I have said, neonatal nursing is indispensable in improving newborn survival, though it remains undervalued in many parts of the world. So we need to advocate for recognition, we need to foster innovation, and we need to build supportive environments. So we can strengthen this vital workforce together as a team of partners and organizations. And I'm calling all of us to work together to empower nurses and ensure every newborn has access to specialized care that they deserve. Thank you so much.
Thank you. Thank you so much for that remarks and Patrick for emphasizing the need for recognition of neonatal nurses as a specialty. Colleagues, that does bring us to the end of panel's reflections. I think somebody's slides are being shared. If you could stop sharing them. We have two further reflections, one coming up from Sheikh from APHRC and with Countdown 2030, and another one from the Laredale Group. First, I come to you, Sheikh, if you could share briefly, in the interest of time, your reflection on planning and financing, and especially looking at the data-driven planning and investment needed for health workforce. Sheikh, over to you.
Thank you so much, Rajat. This is wonderful. Dear Excellencies, dear partners, dear colleagues, this is really a great honor for us to engage in this occasion and speak about this important topic that is speak to a health workforce. So I think we just start by saying that we must confront this reality that reducing maternal mortality remains really a very, very pressing challenge, a very pressing global development, and the urgency to really look at it, look at this as we approach the 2030 deadline. I think for achieving SDGs 3.1 and 3.2, which aim to reducing maternal mortality. So what I want to say, maybe a lot of things have been mentioned actually in the previous, but speaking to your point about how we think data-driven planning and financing will really help or have helped actually reducing mortality in a lot of countries. So for us, we think that it's important that data must be at the heart of the workforce planning. If we want to reduce child mortality and maternal mortality, without reliable data, it's not possible actually to accurately assess health workers and then identify the skill gaps that are important really to know, to understand, and to document. Also to look at measuring the quality of the service that are being delivered. So just an example of something that is really important and speak to data-driven. Geospatial mapping, for instance, of the distribution of health workers. That's a very simple and unique approach of really, of the value of data-driven planning, where you could know where, what are the gaps and where actually are the issues in terms of health workforce to target actually investment, and also underscore or identify those underserved areas that are really important. So recently, in a workshop, in a meeting, in a meeting with the West Africa Organization, West Health Organization, where we looked at issues on health workforce in the West Africa region, we identified several issues. Some have been mentioned, but I'll just mention the one that have been mentioned so far. Of course, the funding gap is there, but also the issue of motivation and retention has been properly highlighted, and documented, and it has something that hinders a lot of effort that are being done. But also, someone talked about the gender disparity, the gender issue, the gender gap actually in the health workforce, which is also critical. You refer to the leadership, which is rare, and we all know the issue of the leadership there. But also the pay disparities. I don't know how much we talk about the pay disparities between men and women in that area. Also, the limited career progression opportunities, because as a woman, it's very hard for some of them to go further into the, addressing their career and all of that. And that has been also documented in some of those countries. But more importantly, actually, is the leadership and governance bottlenecks that are there. Because you see policies that are there are policies, but some of those policies are most of the time inconsistent. They are not speaking, they are not aligned with actually what actually has to be done by the country. So to that extent, actually, we need to maybe going back to the issue of data-driven, in helping identify where maternal mortality rates are highest, and also where maternal health workforce shortage are the most accurate. That's actually a very important thing that we've been doing in the Countdown 2030, whereby through this country collaboration that we set in the 26 countries in Africa, where we have academia and government analysts stick together, and define their own agenda. Because that's also an issue, a big issue, where you allow or you let the countries derive or think about their own agenda, how they would address those issues. That's what we do in the Countdown. And the other thing actually is how data-driven could help targeting investment and planning and actual action, just in short. So basically, what I want to say before probably just sharing a few action points that I think are important is it's important for us as players, as really program and data people, to accompany, to work with those countries and government in particular into not only advocating for data-driven planning, but also helping them into doing that, because the capacity sometimes is also lacking. And our role in supporting government, in supporting players to devise some real strategies that really are based really on data are really the way to go. So as we conclude, we will just want to make 2 or 3 points. I think the issue of, we talked about that, the issue of sustainable financing. I think we are all on the same page that without finance, without investment, there's no way we could capacitate, we could also retain this talent that are there around this area. But also the issue of strengthening governance and accountability, because we all say, you see a lot of policies, a lot of government that document, that highlight the number of, the amount of money that that have been invested into the health workforce. But then if you look at the impact and also the quality of care, you question actually how far we are really challenging, we are really going deeper into, evaluating those strategies and policies to ensure that, it is really addressing critical points. So as we conclude, I think we need to mention maybe 2. Government must lead an integrated and health workforce strategy into national development agenda. I think that has been mentioned. Civil society, someone has mentioned that. The role of civil society and personal association to advocate for health workforce welfare and equity, ensuring that accountability to the community we serve, actually. And the last one actually has to do with private sector, because we've seen in those evaluations and also in those work that we've done in the past, how the private sector can support through innovation And actually, you have some concrete example of innovation that have been done in some countries where, you know, the digital application to monitoring pregnancies and all that have been really wonderful to improving actually these services. So in closing, achieving the SDG target for MNC is possible to require, is possible, but requires urgent, collaborative, and sustained action. Let us commit to empowering health workforce as the cornerstone of health systems that deliver not just survival, but dignity actually, and quality of life for all of us. So I'll stop there for the sake of time, but also happy to answer any questions that you may have on that. Thanks, and over to you, Rajat.
Thank you. Thank you very much for that, Sheikh, and really appreciate your remarks. And last but not the least, coming to you, Asmita, for your reflections on education and employment and innovations to support the health workforce. And for colleagues that don't know the Lauderdale Group, it's one of the organizations that I have come to admire a lot for their unique way and innovative techniques through for supporting health workforce. Asmita, over to you for your brief reflections. Then I hope that I can come back to the panel for some quick final reflections to what they have heard and some of the issues that have been reflected as well. Asmita, over to you.
Thank you, Rajat, and thank you for the very kind words. Her Excellency, Dr. Daba, and respected delegates, it's an honor to be here today with you all. I would be speaking more on from the education and the innovation side. So we all see that health workforce is one of the most important pillars for a strong healthcare system, and the competency of the health workforce and equipping the health workforce with the right tools is very crucial. We see that there's a projected shortage of 10 million health workforce by 2030. Thus, there's a coverage gap. But at the same time, this coverage gap is also leading us and challenging us with a quality gap as well. So when there's a quality gap, that's impacting the overall healthcare system and the service delivery. Thus, I would like to urge or bring this to all the partners that I think we would have to look into different ways of enhancing the quality of the overall education that has been provided within pre-service and also in service. So the students and I see so many of medical students and nursing and midwifery students joining in this call today as well. So enhancing their capacity so that we have a work-ready workforce, but at the same time also focusing on the in-service and building on their capacity and strengthening that as well. I would like to share one of the programs that we have been implementing in Tanzania, the Safer Birth Bundle of Care, which brings in clinical innovation, training innovation, and different digital solutions bundled together to overall enhance the quality of the healthcare system. So the Safer Birth Bundle of Care is more of designed in a way where there are simulation corners being developed within the hospitals, that's in situ, and the healthcare providers are able to implement simulation sessions on a regular basis. So they have a low dose, high frequency training sessions and collect data out of those sessions so that they can see where are the gaps within the healthcare system and develop their training solutions. Ultimately, what they have been doing within the training is being impacted in their clinical site. So there's the transfer of knowledge from within the training to the clinical. And I think that's where the gap is, and that is where we would need to address how can education be transformed or developed in a way so that we see the impact that we are wanting to see to reduce the maternal and newborn mortality. Also, I would also want to bring into all the partners of how can we look into having different innovations, could be digital solutions, and looking at from a practical way, because we often see that we have digital solutions, but the bandwidth is high and we're not able to use it, or we cannot use it offline. So within the Safer Birth Bundle of Care, we have also been aiming to develop digital solutions that can be used by healthcare facilities with low bandwidth, and considering and customizing them as per the need of that particular area. Thus, I believe it's time for us or for all partners to consider innovative ways within education. And I would like to highlight that it is not only about developing or building these different innovative solutions, but it's more of measuring the impact that it creates. Lastly, I would also want to highlight the role of a private sector can play in developing education and different innovative solutions leading to quality service delivery, and where private partner can support in the development process and the government can come in together to leverage, to regulate, and to create a scalable and sustainable model so that we have a competent health workforce ready to be there and provide the competent services to end preventable maternal and newborn mortality. Considering time, I would just want to stop here. Yeah.
Thank you. Thank you for that, Asmita, and also accommodating the shortness of time. Really appreciate your flexibility. Colleagues, we are unfortunately end to our conversation, but I do want to come back to Anne, Chiara, Naveen, and Sandra in particular for some final reflections. You've heard a lot from our distinguished keynote speakers. You have heard, a lot of questions that have popped up. Some issues in terms of resourcing, financing, collaboration, partnership, but some, key questions that have come up about burnout and strategies to address that gendered dimension of health workforce challenges, both in terms of the kind of, issues that women healthcare workers face, but also violence-related issues. And also, ultimately, we came a lot back and forth about the role of young healthcare professionals, several of whom are online. So if I could come back to you all for just 1 minute last final reflections as we conclude on how do you see the way forward on these things. And if I could start with Anne Chiara, if she's still online and with us.
I am with you. I'm here. I think, Rajat, the first thing that is critical has been mentioned is the utilization of data to inform. The second one, and most importantly, health workforce is a human resource. Are we even conducting human resource performance matrix to actually understand what is pertinent for me as a technocrat, but also as a human person? So the enabling environment, I've seen the question that reflects on the women and their pregnancies and how do they take care of their children, even while they're still trying to conduct their services. I think the performance matrix for human resource, health resource, needs to really come up. The third thing that I want to mention is really strengthen this collaborative. Having come together as the HCPA, different disciplines coming together, I think is the beginning of changing the dynamics and accelerating maternal, newborn, neonatal, child, and adolescent health.
Thank you. Thank you for that, Anne Chiara. Naveen, 1 minute and less.
Yeah,
Over to you.
So you have asked so many questions. I don't want to deal with that. I will say what I want to say. What I hear. So yes, there is a role of young people. There is role of everyone. And as we see, we have so many things to do. And as I said, we have to see that government takes the ownership. If we just have depend on the donors, and donors, as I said, they don't want to work everywhere. So it's very important government takes the ownership for the health workforce. And second thing, as it was said, innovation. innovation and new ways of reaching to our health workforce, whether it is mental, whether it is education, whether it is, and many things. Pandemic gave us opportunity to develop and test many things which we could have never done. So let us all work together, collaboration, innovation, and totally. Finally, it is government should take ownership for their health workforce. Thank you.
Thank you so much, Naveen. Sandra, to you for some final reflections, and then I do note, Dr. Daba, Your Excellency, you are still with us, and I would really want to see if you have any final reflections before we conclude. But Sandra, over to you.
Well, thank you, Rajat. And I think, of course, we've heard through the whole webinar, the most important thing is that working together. The only way that we can work together is showing that we work together. And this is an example. And because, of course, we have to take it down to country level. And of course, in that area, we'll also have a lot of opportunities advocating together for policy change at country level, of course. That's what we need. The recognition of healthcare workforce is really important. Because, of course, without a healthcare workforce, we cannot move forward. Of course, gender equality. We have to really be strong advocating for gender equality in the healthcare workforce because it's essential to break down all the barriers. And we are to be together for this, especially as midwives, that, of course, we need support and we need to move forward investing in midwifery education and, of course, the whole healthcare workforce.
Thank you. Thank you for that, Sandra. Dr. Daba, any final reflections having heard all that you did from your vantage point as the Minister of Health?
Thank you very much, Rajat. It was really an informative discussion we had, and most of the questions that came are also aligned with what we've been discussing, because the role that healthcare professionals and the health workforce really plays have to be seriously seen. And it takes everyone's contribution, because the resources we have, especially in our region, is very limited. But ensuring that one of the drivers and the engine would only continue if we make sure that the health workforce is taken very seriously. And as a reflection that I want to make from the government's perspective as the Minister of Health, every political decision that we make have to ensure that we are addressing the requests, the demands that are coming from the health professionals, discussing with them closely, and ensuring that their voices are heard, are very critical, and coming together with all stakeholders, ensuring what would be the thing that we should do together, have to be a continuous discussion. And this is not a discussion that would just stop in here, but it should be a discussion and agenda in all platforms, at a global level, at a regional level, at a national level, and all political decision makers have to ensure that we have to take this agenda forward, and we commit for what would be needed to keep the health workforce to address the perinatal, maternal, and newborn and child health related issues as a whole. And I really thank you all, because this is part of the start, but a continuous discussion that we will do to ensure that we're addressing for our generation, but also for the entire health workforce. Thank you.
Thank you. Thank you so much, Dr. Daba, and for staying through the conversation as well. And for that very important final comment, which is a very good way to conclude, because the whole emphasis of this dialogue series is indeed what will it take to accelerate action and implementation at the country level so that we are able to reduce the preventable maternal, newborn, and child mortality. Colleagues, thank you so much for joining us. Apologies for any questions that we were not able to get to. We will continue this conversation. Thank you all for sharing all the resources that you did in the chat. The final dialogue for 2024 in this series will be on December 10, focusing especially on healthcare financing issues. We will share more information on that, but for now to say thank you for your leadership and for the work that you do. Have a nice day. Thank you.
Thank you.
Thank you.
Bye.